Hi, everyone. We are here today for another one of our safer radiation therapy educational sessions. And I'm excited to introduce Raizy Streicher. She's a radiation therapist and has been one for 6 years. So today we just thought we would share some insights about radiation treatment and really learn from Raizy in regards to her experience being a therapist, treating patients. So with that, I'll just, Raizy, why don't you just start with telling us a little bit about yourself and what you do?
Hi, thanks for having me. So I am a radiation therapist. I've been one for 6 years now. I live in Spring Valley. I have four children, and this is what I do. So I always wanted to get into cancer care in general. I spent some time volunteering for an organization that helps families who've had children diagnosed with cancer. So I used to help out with the siblings, or just go on different like events to make the families just to make the experience a little bit more positive for them when they're going through a hard time. So I was already in that world. And actually, my grandmother, the one who I was named after, was diagnosed with breast cancer at a really young age. And unfortunately, she passed away from complications from radiation therapy. This was a long time ago. There's brand new technology. So I definitely was put on this path. So I went to school, and as soon as I started the program, I knew that this was what I wanted to do. So I graduated in 2017. I actually had my daughter 2 days after graduation. And I got this job that I'm working at currently when she was 3 weeks old. And I started, and I've never looked back. So grateful to have this opportunity to be able to be there for the patients every day, to be on the forefront of technology updates, changes, cancer care, and I'm super grateful.
Yeah, and having the conversations we've had, it's really, really wonderful to see somebody who's so committed to patient care, and then also obviously wanting to do something in the cancer arena and be able to find a profession and a career and be successful. And as you just shared with me before we started this video, how much you love what you do. And as busy as you are with four kids and a full-time job, and you still feel very satisfied and motivated by what you do on a day-to-day basis to help cancer patients. So that's absolutely wonderful. um, so you chose to become a radiation therapist. How did you decide going into like radiation therapy, and maybe talk about what a radiation therapist does for someone who's just kind of learning about radiation treatment?
Yeah, so I always tell the patients when they come in on the first day that I think the biggest source of anxiety for them is just the unknown. Like, there's not a lot of information out there unless they've had like firsthand experience or know people who've gone through radiation therapy. It's just tough to go through something that you have no idea. Like chemo, you get physically injected with a medication, you see it going through, and then they see the effects with radiation. You're kind of like, you're laying on the table, nothing's really happening. So I feel like I always tell my patients, like, if you know anyone who's in radiation therapy or has gone through radiation therapy, definitely like reach out to people, get information, because that's also like once they come in for that first appointment, I already see them like breathing easy because now they just know what to expect. I love technology. I was born in this computer age, so I feel
Mhm.
like radiation therapy specifically is geared for young, like techie people because the field is so much, it's constantly changing. Like every minute, every I go on vacation, I come back, there's like a huge change, and I have to like adapt to that, which I like. Obviously, that's sometimes difficult, but that's really like one of the biggest parts of radiation therapy that I enjoy is that there's constantly like pushing boundaries, looking for things that we could better the patient experience, minimize side effects. So that's really cool. And also on the patient care side, when patients are going through this, they see the doctor once a week, once a month. They're checking in with the nurse like periodically, but the radiation therapists are the ones that are there every single day, checking in on them, getting to know them. I know my patients like facial expressions. I know when they walk in
Mhm.
the morning, I'm like, "What's up?" Like I know when
Mhm.
things are going, when they're okay and when they're not okay. So I feel like very few um medical professionals have that opportunity to really like get to know them because you're seeing them every single day. Sometimes it's 5 treatments, sometimes it's 40 treatments.
Mhm.
So, you get to know their families, and you get to really see their story and hear different, and it makes us more aware as well, like to pay attention to your body and to pay attention to side effects, and we're there as a resource to them emotionally and physically.
Yeah, that's one thing I noticed too when I went on visits to customers and spent a day, at a radiation treatment center, is the people would come in and they'd be talking with their therapist about, oh, it was, how'd your son's birthday go? Or, oh, your daughter graduated, or there was just that real personal connection that definitely I saw it and experienced it. So it's nice. I think obviously as a therapist, you really have to love working with people and engaging with people and make them feel comfortable, because it can be very intimidating, that environment, that treatment. So, yeah, I can see where that would be really a fun part of kind of your position. So that's great. So let's just talk about radiation treatment and radiation technology. What is radiation treatment? Like, what does it do? Why is it used?
So radiation therapy is high levels, very high levels of radiation that are targeted specifically towards the tumor or the area where the tumor was. We treat it for a number of reasons. We'll either treat a tumor that is inoperable, we'll treat a tumor that has been taken out, and we want to make sure that the area, there's nothing left. And so it's very high levels of targeted radiation that is meant to destroy cancerous tissue. Unfortunately, along with that, sometimes comes healthy tissue that's in the way. But with technology and precision planning, we're able to avoid a lot of the organs at risk, the healthy tissue, to make sure that we're only targeting the area that we actually want to treat. And this is to make sure that the patient will either have a lower level of recurrence, or maybe we can operate when we're done with the radiation. So there's a number of reasons why a patient would get radiation therapy. We treat all kinds of cancers here. We treat brain, breast, skin, anything in the abdominal area, pelvis, legs, arms, literally anything. And but each patient and each body part that we're treating gets us a totally unique plan with absolute precision to make sure that we're getting only the area that we need to treat. Radiation is something that once you give it, you can't take it back. A patient who's exposed to these levels of radiation, it's obviously it needs to be for a real reason. So we're super duper careful about precision, patient. It's super important the patient stays still the entire time, which I'm sure we'll get into. So that's basically the idea.
Excellent. Thank you. So you shared the fact that it's so important for, patient positioning. Can you just share some of like the advancement in radiation technology that have kind of improved treatment or enhanced treatment and maybe made, your job as a therapist as well as your colleagues made your jobs easier to really deliver radiation effectively?
So when a patient comes in and we plan for their radiation, we make an immobilization device that keeps them in the same position every day for the treatment. So it depends on what we're treating. We make masks, we make different types of molds, all with the purpose of keeping the patient still and stable throughout the treatment. In addition to this mold, we have traditionally given tattoos or little marks that we give on the first day, and we make sure to be able to line up the patient using these marks. So they have been effective in getting the patient into the position that we need, and then we'll go ahead and verify all that with x-rays before we start the radiation. But with Align RT, Vision RT, this technology is new. We've been using it for a while now, and it's really changed the game for us, as far as patient positioning throughout the treatment, and also has given patients opportunities to get treated without these marks. So what I mean by this is that we'll get the patient onto the table. We have this system that basically takes like almost like a hologram of the patient while they're laying on the table in real time, and gives us the position information of where the patient needs to be, so we can make those adjustments in real time on the machine while we're about to get the patient ready to go. Instead of using tattoo marks, we're using a system that not only helps us with patient positioning but tracks us through the treatment, so making sure that that patient is still stable and not moving through the treatment. Whereas with the traditional way we've been doing it, we would set the patient up, you take the x-rays, you remind the patient again not to move, But at the end of the day, throughout the treatment, you don't really have that like constant reassurance that the patient is exactly where they need to be. So with Vision RT, this has been a game changer for us. Patients are so thrilled when we tell them that they don't need the tattoos, and it's a really effective system for us, and it's made our lives so much easier.
Mm. Yeah, I think, some way we kind of explain and talk about that hologram is almost like the Align RT system kind of projects virtual tattoos on the body surface. So it's like thousands of tattoos, virtual tattoos. So you don't have the permanent marks, but what it does is it monitors your positioning to sub-millimeter accuracy so that if you even shift a millimeter, less than a millimeter, it's going to notify you as the therapist, whoa, that patient has shifted out of position. And potentially now, if they stayed out of position, now there's a risk of radiation being delivered to the healthy tissue or to potentially an organ, that's close to the treatment center. So yeah, we're excited that our customers have given us the feedback that with our technology and the assured accuracy and the information that's provided during treatment, that we can help drive better outcomes, improved outcomes, and enhance the efficacy and safety of treatment. So it's been exciting to see. In regards to tattoos were the standard and traditional approach. Our technology, this advancement, is eliminating the need for those tattoo and marks. So, and a lot of patients have said, I think there was a study in the Breast Journal that said that 78% of patients would prefer not to have tattoos. So I think that's going to be the future of treatment moving forward.
Yeah,
So,
it's really incredible. And
mm,
also what's so interesting to see is really truly how accurate it is. Like we set them up and we'll always do an x-ray. We're always checking to make sure, and our shifts are just usually really really minimal, which is very reassuring. And like we're using it and we're very happy with it, and so are the patients.
excellent, excellent. All right, let's talk about a typical day for a patient. Like, what does a typical day when they come? I guess there's kind of two phases. There's the planning day, and then there's the actual start of treatment. So maybe you can walk through those two phases and what that entails and what they can expect.
Sure. So I do actually run the planning portion of this. So I'm usually in that department. I jump around a little bit, but I have spent most of my time in the planning department. So generally, what we'll do is the patient will have a consult with the doctor, basically referred by a doctor to come in and go over their case. The doctor will then send us a sim order telling us exactly what area we need to treat and how many treatments the patient will receive. So when we make this appointment, they come in and we do this planning session. We call it a simulation, and the reason for that is that we kind of simulate and show them exactly like what it will be like when they get back here, when they come back for the radiation. So during this planning session, the patient will come in, and like I said before, based on the area that we're treating, we'll create an immobilization device, whether it's a mask or a pelvic mold or something with their arms up, just to make sure that the patient is positioned properly for the treatment. And then the planning session is a CAT scan, a plain old CAT scan, not a diagnostic scan. There are no results that come from this. It's specifically planning and gets put straight into our treatment planning system to be worked on by the doctors and the physicists. So our job is to basically explain what they'll be experiencing and show them what it's going to be like while we make this mold for them. And then whether the doctor wants the tattoo marks or not, that's a discussion that we have beforehand. And then part of that session, when we're done with the CAT scan and the planning, is we'll give these patients those marks if needed. And then they come back about a week and a half later. That's how long it takes generally to plan things. I think patients aren't 100% sure about that. They come in and they're like, okay, I'll see you tomorrow. This is very high levels of precision. A lot of patients have had previous treatment before. You can't re-irradiate the same areas. So it's a very complex process. And so it usually takes about 2 weeks or so, a week and a half to 2 weeks to get the plan ready to go for the patient. So that's the planning process of it. Once they come in for the first day, we call it a setup. And that is the day where we take verification imaging. The patient will lay into the same mold that we made from the first day. And if we have the tattoos, we'll line up with the tattoos. If we're using Align RT, we'll use that. And we basically position the patient exactly how they were on the day that they came in for that planning session. We want to replicate exactly how they were from that time. that they came in for the first planning session. So we take our x-rays, we make sure that the target is in the right area. And then on the first day, we'll usually have a doctor or a physicist come in to just double check and make sure everything's good. We talk to the patient, remind them exactly what's going to be happening and how important it is not to move. Um, Generally, we'll like put music on, or we'll give them some warm blankets. We'll talk to them. There's a two-way audio and video system. So if they want to talk to us, we are here to do that. Some patients have breathing or coaching instructions that they need. So we're constantly talking to them, working them through the process, letting them know where we are at that point. And then when the radiation is delivered, it usually takes a couple of minutes or less. The patient remains still. You don't feel anything, see anything. It's these high level radiation beams that are being targeted. And then the patient's escorted out of the room and off the table. Each session's about 15, 20 minutes, depending on what we treat. Sometimes the doctors will opt for a shorter course, but longer appointments, or vice versa. The patient will come in for a lot of appointments, but very short ones. So it really just depends. And I also tell my patients all the time, you can talk to patients who are going through radiation therapy for support and
Mm,
advice, but never like compare your story to anybody else's, because every single case in cancer care in general, but also with radiation, is so unique and so personalized that you really can't like, oh, this one's getting 40, that one's getting 30. Why do I have to hold my breath? Why does she have to change? Why do I not have to change? It's just so individualized, which is really what I love about the field in general. It's so different. Every time a patient comes in, it's a whole different story. So that's pretty much the day to day for each patient and what they can expect.
mhm. Excellent. Yeah, that's good. And saferradiationtherapy.com, we have all sorts of information in regards to your treatment, in regards to frequently asked questions, what to expect. So, in addition to the content that you just shared, Razy, there's also all sorts of information that, patients that you can refer to on our website that might be helpful. I think one of the huge challenges for patients is when they move through each stage of their cancer treatment, there's so much information. It's almost like information overload. And so I think if you can listen to and look at and read and explore multiple different sources of information, obviously, I think that can be a huge benefit and make things easier. The more informed you are, I think the better you're prepared to manage your treatment effectively.
100%. Yeah.
Yeah. Yeah.
100%. And also
Yeah.
a lot of the cancer treatment happens very quickly. So they'll get a
Mm,
diagnosis, and then literally the next day or the same day they're laying on the table, we're planning them for radiation, and they're like,
yeah.
I don't even know what just happened. So I feel
Yeah.
like with us we have to really like work on our, it's obviously it's a tough field to be in. I try to focus on the positive,
Mm,
see like all the good outcomes, get to see the patients that come back that have a good result. So many people will ask me like, how do you do this? It's so depressing, but
mhm,
again, I just try to focus on the positive, try to like pour myself into these patients, put myself into their shoes, try to be that person who they can count on or ask questions to, or just get support. And it really makes a difference in their journey where you have somebody
mhm,
who cares and somebody who's really listening, and
mhm,
if I don't have the answers, which is many times, a lot of patients will ask us questions that I either can't answer or I don't know. At least I'll be able to say like, I can't answer you, but I'm happy to reach out to this doctor and I will call you back and let you know exactly what they said. Just like getting them to feel like they have like that support, that connection, it really helps them navigate through this like terrible time.
mm.
Yeah,
Yeah, and I think that brings up a point of, where you get your treatment is important. Whether you feel like you're getting the best possible care and you're getting the best possible support. And so I think if you're looking and exploring where to get the best treatment, I think it's important that you kind of do the research, explore what centers and what what they specialize in and what kind of technology they have. And, do you connect with their team? Because I think ultimately that's going to benefit you. It's going to give you either peace of mind that your questions are going to be answered or that you're going to get the best possible care. So just, don't be intimidated by it all. Ask questions, do the research you need to do to make sure that you get the possible care, best possible care you can. So in closing, Razy, I think we've all this information is incredibly valuable. So thank you. But in closing, if you were going to talk to somebody who's just now, hey, I now need my radiation treatment, what advice would you give to them as they kind of prepare for this stage of their treatment?
I think, like I said earlier, that one of the biggest anxieties for patients is the unknown. So try to get as much information as possible. Like exactly like you said, Lisa, there's a lot of resources, and that's part of why we do this to bring education to patients. Because if they have an understanding a little bit of what they're going to expect, it really helps. Also to know what you need. Like if you're the type of patient that doesn't do well with certain scans, or you have like claustrophobia, be your own advocate, ask for the medication, try to prepare yourself, think about what could help you through this process the most. And then every single week, the patients will see a doctor and a nurse to check in. But just because you have that appointment once a week doesn't mean you have to wait until that appointment. The
Mhm.
radiation therapists are there all the time to help and to be there for you. And if you have questions, or you're not feeling right, or you think nothing is too big, nothing is too small, speak up, bring it up, be your own advocate, because we're really here to help. So I would say, like, use everyone around you as a resource, and get as much support as possible. I also feel like patients who have family or friends um, around them during this time, it really, really helps. I know some people try to keep it quiet. We've had those patients too, and everybody goes through this journey the way they need to go through it. I'm not here
Mhm.
to tell you how to do that, but I do see the difference between the patients that just have that support, and the ones that don't. You don't have to do this alone. Everyone is here to help you, to guide you. That's extremely important.
Excellent. Well, thank you, Razy. I think this is going to be invaluable to everyone, and we're going to share it on safer radiation therapy, and hopefully, many patients will use this as a resource, and yeah, also go to our website for additional information. So, thank you for everything you do every day to support cancer patients.
Thank you for this
We
opportunity. I
appreciate you.
appreciate it.
Yeah, excellent. Thank you.
Thanks.